Hey guys, my name is Jeff Witherspoon. I'm the CEO of E2M Fitness. I've trained over 220,000 clients, mainly focused on weight loss and weight management. Over the last year, we've seen an influx of people with interest or actually taking weight loss medication. A lot of folks in the health and fitness space aren't directly addressing this, and I want to address it head on. I want to talk about it today. I have one of my close personal friends, Dr. Jones, here, and she and I will talk in detail about some of the questions my clients ask and some of the things people ask us that just nobody wants to talk about. And so today we're going to talk about some really tough topics and tie it in to how the health and wellness space should embrace people who are prescribed those medications and who need them so they can focus on being healthy. So first and foremost, welcome, Dr. Jones.
I'm so happy to be here, sir.
I'm so happy to have you. Just for the record, I've been knowing Dr. Jones for 20 plus years.
Yes, it's been a long time.
Yeah, mega proud of you and all your accomplishments. You've been on CNN, HLN, many local broadcasts. So more than thankful to have you here today. I couldn't pick anybody better.
And the feeling's mutual. I have so much respect and I'm so proud of you.
Yeah, I appreciate that. So I have a list of questions, but I'm going to start out by letting you introduce yourself however you want to do that. I know you have a lot of accolades, so I won't mess anything up. So on you, Doc.
All right. I am Dr. Barbara Joy Jones. I am a primary care physician, board certified in family medicine. My practice is in Lawrenceville, Georgia. And so I'm seeing anybody in and around the Atlanta area. And I do primary care, 12 and older men and women. On the side, I'm a plus size model. I also am a media expert. So as Jeff, you said, on air nationally and locally. I am the founder of White Coats and Gavels, which is an exclusive group for basically anybody who's a woman of color, who's a physician, attorney, or judge in Atlanta. They're in my group, White Coats and Gavels. And most recently, I am a mom. I'm an IVF twin mama.
Oh, yeah.
So my little babies, Louis and Jillian. Yep. So the last time I saw you was we did a podcast episode when I was first trimester, and I let you in on the secret. And here I am postpartum on the drugs we're about to talk about.
Yeah. I love it. Okay. So I'm also your personal trainer. I also train you.
Oh, yes. In E2M. Been a member of E2M since May of 2020. When I was getting ready for my wedding.
Oh, that's
and if y'all go back to my wedding pictures, I was snatched. I was looking good. Thank you, E2M.
Very good, for sure. So let's talk about that a little bit. So how did you, of course, you've been knowing me for a long time. Why did you decide to do my program? So for those of you who don't know, I run different weight loss and weight management programs. And Dr. Jones, as a doctor, decided to join one of my programs. So Doc, why did you decide to join?
So first, you're a walking billboard of health. So I'm not going to try to follow someone who doesn't look like health and wellness. And you look that way. You speak that way. 360, you are health and wellness. We've known you, I've known you for over 2 decades, and I just trusted you. Also, come into 2020, there was a huge shift because of the pandemic where things that used to be in person and in the gym, that now you can actually work out from home. And you were so much ahead of your time. You were a couple of years ahead of, and you formed an online virtual way of doing things. And so if I could attack the way that I eat and exercising and do it with you online, I was going to do that. And I did. And I got snatched. And I'm about to do it again postpartum. That's why I joined. And it worked.
Now, Dr. Jones, a lot of people and some folks may not know who I am or know anything about me. I've been blessed to have lots of doctors do my program and advocate for my program to their patients. Why do you think so many doctors have kind of gravitated to my program? I know why, but of course I'm going to say I think I'm the best. But again, I'm blessed and thankful. But why do you think so many doctors actually join my program and find community within the program?
The first thing that comes to mind is the fact that in conventional medicine, when people are using their insurance and they pay their copay, because insurance companies have decreased the amount they pay us, we have to increase the volume, right? So we might only get 10 to 15 minutes with the patient. And although I know that they need to be eating right, exercising, and doing all those things, decrease stress, meditation, and have a sense of community, that's what you provide. For me, I can draw the labs, I can tell them, and I can suggest to you, because if there's 20 patients in a day, I can't do what you do. So it actually makes patients healthier and helps me out because you're doing the work of the mind shift change, of the meal prep, of the exercise. And I get to go room to room. And if it's already in one package with you, I can go from room to room. And that's the suggestion. That's for me personally why I suggest E2M. I mean, it makes my life easier because y'all have already done it.
You know, I love that, Doc. I think what you're saying is very similar to what I've heard from a lot of my other doctor clients say. When you see a person has high cholesterol or needs to reduce their body weight, needs to move more, things like that, you're not a personal trainer. You're a doctor.
Nope.
So you can't prescribe them a specified. You say, well, what do I eat, doc? Eat healthier, right? What does that look like?
What does that mean?
Right? What does that mean?
In medical school, I only got 4 hours of nutrition education. So how do we educate if we don't even know?
Exactly right.
I mean, thousands and thousands and thousands of hours of training in medical school and residency, but 4 hours of nutrition training. Like, I'm not even the expert, okay?
You know, and again, I think a lot of people just assume because doctors are doctors that they're experts in everything. That's just not true. Doctors have specialties, and doctors are very smart people. I know Dr. Jones is extremely smart, but that doesn't mean that they know everything about everything. And it also doesn't mean that it's easy for them to take care of themselves. I know for a fact, and we just had, again, I'm a thankful guy. You will hear me say it a lot throughout my podcast here, but we had so many medical professionals that lost their own health during the pandemic by taking care of other people. Did you see that a whole lot during the pandemic for yourself and for others around you, your nurses that work for you and your assistants and things like that?
Especially during the pandemic, obesity and like diabetes doubled because you had this sedentary lifestyle, you had the, social distancing and staying in the house. And what is comfort? Comfort's food. You feel good for the moment, even though the long term it's not healthy for you. Yeah. The pandemic was not very good for people's metabolic health.
Exactly. And so we saw over the pandemic, a lot of people, either focus on their health, and that worked out for me tremendously. We had a super high influx of folks that wanted to be healthier because they were fearful of not being healthy enough to survive if they were to be diagnosed with having COVID. So they took their health a lot more seriously. But a lot of people, because they were at home so much, because Uber Eats and DoorDash and everything else, and sedentary lifestyle, not getting outside, not moving around, they put on a lot of weight. And so with the craze that's going on right now in the healthcare industry with semi-glutides, and people may not know what that means, they mostly hear the term Ozempic. But Ozempic is only one of the medications. So first of all, have you seen a big shift or change in healthcare and more people talking about weight loss meds, semi-glutides, Ozempic, things of that nature?
So usually it's the physician who introduces medications to patients and educates them. But we see an influx, and I see this, and I know all of my colleagues, patients come in requesting the medicine. So yes, that it has to be on TikTok, on Instagram, out there huge. If the patient's coming in and saying, hey, doc, I saw this, what's up? You gonna prescribe it for me? Yeah. And so your patients starting to coming in, they're coming in now and they're asking you for those weight loss meds. A lot of people just don't know much about them. It's a lack of information. So they'll see the jokes or the memes or whatever else. Right. But they don't really understand it. And so today I want to dig into, from a medical standpoint, from all the things that you've learned, and you actually prescribe the medication. I do.
And you're actually taking a medication as well.
I started semaglutide 3 weeks ago.
Right. So let's talk about these weight loss drugs and how they work. What's some of the popular ones? And again, this is educational. So provide all the information you have, Doc.
So when I have patients come in for a weight loss consultation, and that's what they're asking for, I basically go back to the very beginning. So in the beginning, for diabetes, the mainstay was insulin. So you would inject yourself.
Right.
The problem with insulin is that you can become hypoglycemic. So if you change the way you eat and then you inject insulin, which is a hormone, and its job is to take sugar out of the bloodstream, you can get hypoglycemic. And hypoglycemia is pretty serious. It's actually more deadly than hyperglycemia.
Wow.
So drug companies were like, let's come up with a drug in which somebody does not get hypoglycemic, in which you actually don't have to prick your finger and look for the blood glucose, because you would take a baseline insulin and then you would do something called sliding scale. You would prick yourself, find the glucose level, the sugar level, and then inject yourself with a certain amount of units. That is tedious. And now it's antiquated because they came up with the drug class called GLP-1 agonists. So we have GLP receptors all over the body. Let me start that over. We have GLP receptors all over our body, right? And so the mechanism of action is in the brain, it tells us that we are full, so satiety. In the gut, the job is to lower the gastric emptying. So we delay gastric emptying so that you stay fuller longer. Also can cause insulin sensitivity in the periphery and everywhere else. And they just thought, if we can come up with a drug in which we don't have to prick our finger to look up glucose and that it prevents hypoglycemia and it still treats diabetes, let's go for it. So they came up with the drug class GLP-1 agonist. And in that, you'll hear Trulicity, Saxenda, Ozempic, things like that. The one that became the superstar was Ozempic for a couple of reasons.
Big time. All the commercials and everything. I think it was in the Super Bowl too.
Yeah.
It's all the place.
It became the dream one because it was injected once a week versus other ones you inject it once a day. It also became the dream one. It became the dream one because you could lose 13 to 25% of your body weight as a side effect. So now follow the money. Here we go. And so semi-glutide is the name of that, the generic version of it, Ozempic. Then you also have, now they rebranded it as Wegovy. So what is Wegovy? Semi-glutide. It's the same thing, but now Ozempic is for diabetes. Semi-glutide named Ozempic, and now we have semi-glutide named Wegovy to be called, it's indicated for weight loss. So you got to follow the money. They found, okay, we have two indications. Everybody's diabetic, everybody's overweight. Let's make some money.
Hey, Doc, I don't want to cut you off on that one, but wasn't that kind of similar to how Viagra was discovered? It was treating something else, and they found out that it could treat something else.
So it was made, for blood pressure and heart, and they found that a side effect was, things were getting nice and hard, and for a longer amount of time, and so now off-brand is now the brand, and what it's actually,
and that's kind of the same thing that's happening with the semi-glutides. Ozempic was for diabetes, and through those trials and those tests, weight loss was a thing that occurred. And so,
then they came out with the second class, Mounjaro, also known. So Mounjaro, same thing happened. Mounjaro is for diabetes. Then you have Zepbound for weight loss, but they're both tirzepatide, and GLP-1s as well.
And so these terms and names. Some folks may only know Ozempic, but for the people who've been interested in this stuff, who've been looking it up, you're starting to hear some of the names that are popular out there. So Dr. Jones is showing you she knows her stuff. Keep going, Doc.
So again, the Ozempic was the name, and its generic is semaglutide. So then you have semaglutide, and then you have Wegovy, which is semaglutide for weight loss. That's the first generation. Then you have the second generation, which you hear about Mounjaro. So Mounjaro is tirzepatide. And also Zepbound is tirzepatide, but this one is indicated for weight loss. Mounjaro is for diabetes, but they're the same thing. They're GLP-1 agonists.
Wow. Okay. So you were talking about some of the ways these medications help you lose weight. How can somebody determine if they've heard about these things, they saw the commercial, they heard that their friends were doing it? How can somebody determine if they're a good candidate for it? Is it for everybody? If I decide, hey man, I would like to have my abs for the summer and I need to lose 10 pounds. Am I a good candidate for it? Should I be taking it? What is your recommendations or what are your thoughts?
I think that somebody can find out if they are that, if they have a sedentary lifestyle, if they are overweight, and if they have metabolic dysfunction. So what does that mean and how would you find out? That is finding a primary care physician like me. So go find you an internal medicine physician, find you a family medicine physician, someone who's going to do baseline labs. They'll look at cholesterol, they'll look at your A1C, which we use for diabetes. They'll look at your BMI, they'll look at multiple factors. And a lot of times people are candidates for it. But in medicine, in order for insurance to pay for it, they kind of want you to be sicker. They want you to already be sick, fully blown diabetes, fully blown this, before insurance will pay for it. I personally believe that to be preventative, that these medications are good as soon as you step into that gray period and not just completely fall over and are metabolically trashed.
I like that. And, doing my own research, I've learned that some people do, because it's medically related, get it paid for by insurance, but most people pay out of pocket.
Yes.
And so because I've seen more people that pay out of pocket, I've seen a lot of med spas and things like that are not necessarily a doctor's office prescribing the weight loss meds. Is there any concern or risk on where you get prescribed from?
My thought process is 90% of America is doing these medications the wrong way. 90% of America is doing semi-glutide, Ozempic the wrong way. Because there's a wrong way and a right way.
Right.
The wrong way is to basically prescribe it because someone is a candidate, do no education on exercise and food choices, and let them just run rampant. Now they are losing weight, but the weight is 50% muscle, 50% adipose or fat tissue. Then they come off the medicine, they gain the weight back, but now 100% of it is adipose tissue. And now they fat. You would rather be overweight with muscle than skinny fat.
Yeah.
And so there's a wrong and right way to do it. If these places are actually telling people to do things like E2M, where you eat right and you exercise, that's the right way. Or you're just going to be a bobblehead and have Ozempic face.
And my thing about it is, I tell people that ask me about the medications, is I tell them, if you are a candidate and you do get prescribed, you have to think about it as a three-legged stool. The medication is one leg of the stool, diet is the other leg, and exercise is another. You got to have all three legs of the stool for you to be able to sit on it and have a foundation. And so a lot of people just get the medication.
Yeah.
They don't work out, they don't eat healthy, they just get the medications. And they see results. But like you just said, Doc, it's what kind of results are you seeing? Are you losing good weight? Or are you losing bad weight and your muscle tissue? And how are you going to look when you lose your muscle tissue and your weight? So now, once you come off the medications, and we'll talk about that in a second here, Doc, what body composition are you going to have? And not just that, are you going to be healthier? That's all I care about is whether you're healthy or not. People always ask me, do I care about somebody having a six-pack? I do not care. All I care about is them having healthy labs and being able to have a functioning body for as long as they can.
People are using Ozempic like it's Jesus, like it's supposed to turn water into wine. That's not the case.
All right.
We are supposed to use these medicines as a tool.
Gotcha.
As a tool to shut down the food noise, as a tool to help you eat because you need to eat for sustenance and not because it's attached to emotions. While it's working, because when you overwhelm those GLP-1 receptors, eventually you do lose the craving decrease and the overall the first emotions and effects that you got. So you have to implement the tools in the meantime because eventually you'll be desensitized.
Doc, I'm going to go off script a little bit, and I'm okay because I can do that. It's my podcast.
You're the boss.
Yeah, so a lot of people have a lot of judgment when it comes to people deciding to take, weight loss meds. And I'm a transparent guy. I did too.
Yeah.
I was like, hey, man, that's not the right way. You want to do it the right way. You want to have more discipline. You want to eat healthy. You want to work out. I can help you. But I've trained over 220,000 people.
That's a lot of people.
It is a lot. I would love to train more. But throughout that time, I've learned that what may be easy for some is not easy for everyone because of the term you brought up a second ago, food noise. I sat down with one of my really close friends who's actually taking one of the weight loss meds. And this is a high-functioning entrepreneur, super successful guy, mega disciplined. So discipline is not his issue. Food noise and stress eating is his issue. And so I sat down with him and I said, hey, man, I really want to, before I advocate or support these things, I want to know, man. I want to sit down and talk to you and get your feedback. And he said, I just can't turn off the food noise. And I've traveled the world with the military. I'm a military vet, so I've lived in other places around the world. in this country, you can get whatever kind of food you want, any kind of snack you want, 24/7. There is no lack of food. Even if you live in a food desert, you still have an opportunity to get to some food. And that food is not always good. When you think about one of my favorite shows, this kind of documents how the food industry has evolved, how production of food to find lower cost means. Those means aren't necessarily focused on being the healthiest they can for the human body. They're focused on making money. So even though something tastes good, it doesn't mean it's good for you. And so when he talked about just the amount of food noise when he's going to the gas station, when you walk in the gas station, pastries are right in your face. When you're driving the highway, there's tons of signs advertising the fast food spot. When you're driving on the highway, fast food spot, fast food restaurant. And so it's so much food noise that the medication makes him less hungry and have less cravings. Can you talk about that part, Doc?
So when, let's first touch on the fact that just like a lot of Americans, you thought it was silly. Like, why are you on these weight loss medications? Just do it the right way.
Right.
So there's two reasons for that people have that stance. Number one, you were a victim of propaganda. Okay. Number two, you a hater. That's the other side. So
I was a hater.
People, sometimes people are winning when they're on this medicine. And sometimes people just don't like to see people winning and saying it's the easy way out. But the propaganda, when you think about the propaganda around these medications, you have to follow the money. Okay.
Right.
So if a new medication is being vilified, you have to think it's one of two things. Is it really a bad drug? Or who's losing money if people are on these medications? Okay? So these GLP-1 agonists are helping decrease risk of heart attacks and strokes by 20%.
That part. That's the part, Doc, because he's a high risk for heart attack guy. High stress, and I've personally tried to help him on many occasions. Like, I literally walk to his house, knock on his door, and say, hey, let's go for a walk. Like, literally, I got to save this guy. And it's tough. It was tough for him. But now that he's able to control his food cravings, he's able to do more. He's able to exercise more. And I see him making healthy choices. The first time my eyebrows raised, we were actually watching the NCAA championships. And everybody else was having pizza. And he had a salad. I was like, no, man, you don't eat salad. He was like, if I eat that pizza, I'll get sick, so I don't even want it. So that kind of takes me into my second thing, Doc, because that made me really curious about some of the myths and things like that. And we'll get into the side effects thing later. But what's some of the things that people think these medications will do versus what they'll actually do? And what's some of the misconceptions you've seen out there?
I think that your friend... they're doing more studies, but we have GLP-1 receptors all over our bodies. And we are finding that some people are GLP-1 deficient. So when we're always talking about, just exercise and do this and do that, there are some people who are literally don't have enough GLP-1. So if somebody doesn't have enough thyroid hormone, why are we going to say, just do this, eat right, and exercise, and we don't replete their thyroid hormone? So if someone is GLP-1 deficient, why are we not going to give them GLP-1? Okay?
Good point.
So along with the propaganda about that it's either a really bad drug or that it's actually excellent and follow the money, who loses money when we decrease risk of heart attacks and strokes by 20%? Who loses money when we look at dementia as type 3 diabetes and we're helping cure that? So we're helping keep in place or even put in remission and prevent dementia. We're also saying that it helps put reversal on high blood pressure, high cholesterol, kidney disease. And for me, anecdotally, I have 2 patients with elephantiasis or lymphedema that now can put shoes on because they're on semi-glutide. So who's losing money when people are getting healthier and losing weight? A lot of people are losing money.
You know,
right?
And that's important, Doc. I think my rationale or the thought process that sold me was this guy, my friend, I love the guy, has 2 choices. He can try the medications and see if they work for him, or he's probably going to have a heart attack or a stroke. I could beat him over the head saying, hey, have more discipline, have more willpower. And this is not a person that doesn't understand discipline and willpower. He just had these issues with food noise and stress eating and whatnot. So
the medication is putting heart disease in remission. It's reversing it.
I agree. I wholeheartedly agree. And so for me, that's what kind of sold me. So for the people out there who are like, I just don't like it. You may not like it for you, but there's people out there that could really benefit for things like this. And that's why I wanted to embrace this discussion versus trying to have it be almost like a competing narrative where the health and fitness industry is against the weight loss meds because we want you to do it the hard way. I think there's a way out there to embrace and bring people in who are taking weight loss meds and help them get those other two legs of the stool, how to eat properly and how to exercise, how to take care of themselves so they can actually see the health benefits that ultimately we want people to see. I don't care how you do it as long as you get it done healthy. That's what's most important.
I think that the ideal candidate is somebody who's in E2M, who is eating right, who is exercising and can't drop that weight. And the semi-glutide and the GLP-1 agonist can help give them that metabolic reset and recalibrate them.
I love it.
So it's that person. It's the person who's already eating right and already exercising, doing the weight training, who needs that metabolic reset.
I agree with that. And also the people that a lot of people get to enjoy working out. I remember I was in Louisville, Kentucky, and I watched the Ironman race. And you would expect for everybody to be, Greyhound-looking dudes, super skinny and sleek. But there were some big people running super fit, running Ironman races. A lot of people just have a hard time with saying no to food.
Yeah.
Or eating healthy.
The other part is sometimes people are just so super overweight and in so much pain, having autoimmune diseases or being so overweight that their joints can't even handle it. Sometimes you actually have to get on the medication first to then decrease pain and weight to actually be able to get up and do workouts like E2M. Sometimes you have to do one before the other.
I agree. And I've trained, I've never asked my clients to come out and talk about weight loss meds, but I currently have several of my clients that I train now that are on weight loss meds. And I also have several clients that have had the lap band or weight loss surgery.
Yeah.
And so, looking at what the folks needed that were on, that have recently had weight loss surgery, we embrace those folks. We're like, okay, man, you took some extreme measures to make sure you saved your life, that you got healthy. But we're not doing the same thing people who are taking the weight loss meds. On one hand, we're embracing the folks that are like, okay, you did, and I won't say his name because I don't want no problems, but there's a super high-profile weatherman that had the weight loss surgery. And the whole country watched that weatherman have weight loss surgery and lose a ton of weight and is no longer seen as an obese person when he was an obese person for years.
Yeah.
Most of my life, he was a big guy. And so that allowed the country to kind of have sympathy and empathy for people that had to have weight loss surgery and applaud them versus, demonizing them. And I think we're kind of edging along the same transition with the weight loss meds. People are trying to do something to save their lives versus getting beat up because they didn't do it the hard way. Okay, so my next thing, Doc, with any medication, and this is something I've learned in several podcasts with doctors like you, other doctors, there's a potential for side effects with any medication.
Yes.
No matter what the medication, how good it is, there's always a potential for side effects. So what are some of the potential, and you're not guaranteed to have any side effect, but what are some of the potential side effects you're seeing, Dr. Jones?
Let me preface that GLP-1 agonists are basically not novel medications. They're actually peptides that are already in the bottle.
Okay.
They're already in the body.
Gotcha.
They're just peptides. They're sequences of amino acids that are put together into peptides that are already in our body, and we're just giving them to ourselves through an injection.
Gotcha.
Right?
Gotcha.
Side effects that I see, and actually are common in about 50% of my patients, are a little bit of nausea and fatigue. So I verbalize and that usually happens with the introduction of the medicine or when you're titrating up to a new level, a higher dose. That usually happens for probably a day. And I just tell patients, well, then take it at night so you're asleep when it happens.
Hey, Doc, that's an excellent point. And I do want to dig into that one because in talking to my friend, he talked to me about this and I'm interested. Do you think some of the side effects are because people who are getting prescribed the medication are getting no nutritional advice?
I think so. So anytime you are started on a new medication, those are the top two side effects, which would be a little bit of fatigue and the nausea.
Gotcha.
But also it's when we are actually giving too high of a dose. So I would say go low and go slow.
Gotcha.
So maybe you shouldn't be on that higher dose if you are sick and can't eat and you feel nauseous for a long amount of time.
Got you. Okay. So nausea, fatigue. Okay.
And I will say that when people have headache, when I ask my patients, well, the people who have headache, maybe 1 in 10 it'll be a true headache, but then the other ones are dehydrated. How much water did you drink? Oh, I had 1 bottle. Ma'am, it's 3 p.m. Hello, we need to be going for a lot more water. And if you drink more water, then that headache won't be there. If I see the GI side effects, a lot of times I ask, well, what did you eat? Oh, I had an Alfredo with breadsticks and pasta. So I said, ma'am, is that semi-glutide or is that you? I think it might be a little bit of you, right? Because who says that you're going to start this new medication continuing doing the same thing? So even if people eat less food, but it's still the same food, if your body's still a sewer and you just put this, like basically still put trash in it, it's still a sewer. You need to detox. You need to eat better food. You need to eat nutritious stuff. And that's another thing. Actually, when we're looking at this weight, half of it is adipose or fat tissue. The other half is like inflammation and water weight. You need proper diet and nutrition, vitamins and minerals for your body to say, okay, I'm going to let go of this inflammatory water weight. It's not all fat.
You know, I think that is one of the myths I've seen the most. And that myth is that I can still eat whatever I want.
Oh, no.
And it's like, that's not really. I mean,
okay, let's keep it real. They are going to lose weight. They will lose muscle and fat because they're calorically deprived. But then as soon as they come off of the medicine, now they're just gaining, they're more metabolically trashed. And now they have more fat and less muscle and you're closer to death when you have less muscle. Like
that's the part that once I actually got sold on the medications that got me upset. You know, so I turned my hater vibes from hating on people doing the medication to people who are prescribing the medications without giving additional support. Just giving the medication out and not talking about proper nutrition, not encouraging people to exercise, just saying, oh, you want it? I can prescribe it to you. Here, give me some money, go do it. You have to have the other pieces. Because if you want the person to, at some point, maintain the results that they'll receive from losing the weight, they have to have proper diet and exercise. There is no other way. So why not talk about that from the start? Why wait till the person is at a weight that they're like, hey, I think I should come off the meds. I'm getting down to a point to where I feel too slim. Okay, well, how do you go about maintaining that? You maintain it not by eating what you used to eat that got you overweight. You maintain it by adopting a healthy lifestyle and eating a healthy diet.
So I think just like people say that they may be on high blood pressure medicine for a lifetime or thyroid medicine for a lifetime, there is a demographic that why is obesity and diabetes not a medication that we should be on lifetime? But I do believe that you have to implement the tools to keep the weight off, which is the food and the exercise. And I also believe in cycling. So meaning if you overwhelm your GLP-1 receptors with the GLP-1 agonist medications, eventually you will be desensitized. And the first initial high that you got of quieting the food noise and decreasing your appetite and all that, you will become numbed to that. And so you might have to take a drug holiday, but keep your tools that you implemented before you start back. So I actually do believe in cycling, and there might be a demographic. There is a demographic that might need to cycle lifelong to, to keep the weight loss off.
Okay. One of the things that my buddy was showing me, like I've done more research and more information on this because I don't like to have a negative stance on anything, Doc. That's just how I'm a open-minded guy. I don't like to hate on anybody for anything. Like, do what makes you happy. And so when I had these negative responses, I wanted to figure out why. I wanted to learn more. And so my buddy was showing me just like a support group that he was in for people that are taking semi-glutides. And so what got me, it ruffled my feathers, but it's all good. I've been able to help people naturally lose 50, 100 pounds. And this medication is having the same kind of results for people where they're having these, radical transformations, but they're not getting the other two pieces. They're not getting encouraged to eat right and to work out. So they're having these amazing transformations where it's like my before and my after. And it's like, wow, look at me now. But they're not.
Skinny doesn't mean healthy.
Exactly. They're not getting the other two pieces. So while I am very excited for these folks and happy for them that they can move better, that they can exercise now when they couldn't, but if they're choosing not to, or they're not doing those things, they're not being advised to, it's only going to bring the weight back. So I've seen a lot of success stories from what he's shown me. Can you give me maybe one or two success stories from since the time you've been prescribing them of some of your clients?
Yes. So I actually have one that comes to mind who, wife, mother of four, and she was like 300 pounds. And actually had bariatric surgery. And then if you hadn't implemented the tools, she gained it back basically. So getting another bariatric surgery was not the case. So basically we started this medication, but what I require is two things for sure. You have to eat enough protein to replete your protein, and you actually have to exercise. I say at least twice a week. You have to do some sort of strength training to build muscle. And so she was on board with that in the gym 4 or 5 times a week.
I love it.
She was eating enough protein, good fat, and her vegetables and a little bit of fruit. And she just did her due diligence and lost basically 100 pounds.
Wow.
So about 6 foot, 200 pounds. That's good for her.
Wow.
And she feels good in her sundresses. Her husband is chasing her around the dinner table.
That part.
Yeah.
I like it.
She just feels really, really good.
Okay.
And it was because she did the 3-legged chair.
Yeah. You know, people think that I don't bash food. I don't bash any kind of foods. I like to live and enjoy food. I'm a foodie too. But your diet needs to be mostly filled with lean meats, or if you decide to go with vegan proteins, lots of vegetables. You need to eat vegetables, colorful plate. You need to eat healthy. Healthy fats and drink water. Those are just the simple components. If you have more of that, way more of that, at least 1/4 bad food to 3/4 good food, you'll be okay. But a lot of people have it the opposite. They eat very little healthy food and a lot of bad food. Or they'll eat a healthy salad and put a gallon of not so healthy salad dressing on top of that. So
vegetable seed oils. Yep.
I like it. So Doc, can you talk a little bit about your experience so far? Just in terms of why you chose to prescribe yourself the weight loss meds. And you're a mother, you just had 2 children, you own your own practice, you're extremely busy. What made you choose to go that route?
Being a physician, but also being holistically and integratively trained as well, I knew the things that I should do. I know that I should exercise, that I should eat right, that I should do this and do that. But the food noise is very strong. Those cravings, because we relate food to emotions. I'm sad. I'm going to go eat this. I'm happy. Let's go get ice cream. It's related to emotions. So taking the medication was going to be a jump start for my metabolism. 254. The goal is 190. So I got a good 64 pounds to lose.
You're going to get it?
Being postpartum with those twins. And I just needed something that was going to help jumpstart my metabolism and quiet that food noise so that I could eat for sustenance, eat the E2M approved foods, and just jumpstart that along with hopping into starting to work out more and the other parts of it. I just needed that metabolic reset and I needed to quiet the food noise. And I saw it work for my patients.
Love it.
Plus, it's anti-inflammatory.
So
it's actually at these smaller doses is anti-inflammatory, is good for your brain, kidneys, heart, you name it. So if it's going to help with metabolic syndrome, if it's going to help with weight, if it's going to help delay things that are inflammatory, then I'm all for it.
I love it. That's how we got here today. Dr. Jones made a post about her being on weight loss meds. And of course, just divine intervention. That post popped up on my screen. I was like, I'm on it. Because I want to be able to deliver more of a discussion to not only my clients, but people who are interested in how we tie in the two, how we tie in the healthcare space, being prescribed the medications, and the fitness space, keeping you healthy through diet and exercise. How do we tie in the two? So it's not just one-sided, where it's like, oh, don't go the medication route, only do diet and exercise. But what about the people that can't do that? And the same thing on the other side. And so again, you posted about it. What made you feel there's a lot of stigma about Ozempic. You joked about it.
Yeah.
And I'm always, listen, y'all, because I've been doing this for a long time. I have to tread light with any kind of stuff that anybody could feel like I'm joking about or shaming anybody about. You kind of joked about the Ozempic face and that kind of stuff. So what made you feel comfortable? A lot of people, like I told you, a lot of my clients are actually on semi-glutides right now. I won't say a lot, just there's some people who are taking those. But there's some stigma around it. What made you feel comfortable, especially as a doctor, to come out public with it?
Because if it was simply only for weight loss and there was no other health benefit, because there are other weight loss medications where there's actually health risk associated. This is the first medication that is actually anti-inflammatory and who decreases risk of heart attacks and strokes by 20%. This medication is helping prevent dementia, there's so many anti-inflammatory and so many benefits to it. It is actually healthy for you if done the right way. So again, there's two subsets. There's semaglutide done the wrong way and semaglutide done the right way.
Right.
So when you got your feathers ruffled, you basically were getting ruffled about skinny fat. Did they lose weight and have a transformation? But now they're worse off. They're skinny fat. Who wants to be skin and bones? You are closer to death. Elderly patients, we have to decrease the amount of medicine we give them because they have more fat on them. And then the medicine can go into the fat and metabolize less. So the right way to do it is with exercise, is with the diet. So yes, they might look the same, but the proportions of what is muscle and what is fat and what is metabolically excellent is on the E2M side. There's a wrong and right way to look this way. So if you are really thin, but everything's loose and the Ozempic face comes from the calorie deficit, not repleting your amino acids and your protein and losing your collagen. And now you look more sunken in and you look older. So yes, you're thin, but now you look like a skeleton.
Wait, Doc. Like I told
skinny fat.
Wait, listen, I told you I did my research. So the amount of patients that have gone in for plastic surgery procedures, not necessarily full-on facelifts, but Botox and things like that, because they've, had those things occur, those side effects of the sunken in faces and that kind of stuff. So they get fillers. But instead of getting those fillers, anybody out there, work on the other pieces, the diet and exercise. I told you, I'm still passionate about it. But I saw a report where there was a rise in, people getting Botox and fillers to kind of offset that look, that Ozempic face look. So Doc, with this being, the kind of, it's not going anywhere.
No,
weight loss
it's here to stay.
they're not going anywhere. So how do you address it with your clients who they don't want to get ridiculed? They don't want to get made fun of. They don't want to have people talk trash about them because we're still on that bubble of people kind of poking fun at Ozempic, right?
Yeah.
So how do you address that with your clients who they may really benefit from it, but they're a little nervous or they need the help, the assistance?
Just education.
Got you.
So basically letting them know what I stated earlier. If you're a victim of the propaganda, you have to follow the money. If something is being vilified, which these medications are, either they are really a bad drug, which is not the case, or who's losing out on money. And the benefits from it are just not weight loss. It is the anti-inflammatory effects and the decrease in heart attacks and strokes, the prevention of dementia, the kidneys, you name it. It's also helping people with addiction. So they're noticing people that are smoking or drinking alcohol all of a sudden don't want to gamble, don't want to drink. There are so many wonderful benefits to the medication.
I did hear about that. Wow, I forgot about that. There is another study that my buddy showed me where a guy was alcoholic.
Yeah.
And he was taking the medications and he no longer wanted alcohol. And I was like, wow, now.
Watch it get rebranded for alcoholism.
And like we talked about with the Viagra, sometimes you find out just by happenstance, like one medication can treat something else.
Yes.
And so when I heard it, I was like, if this becomes a treatment for drug addiction.
I mean, I think that it will be, and then it'll be more available.
Especially with the opioid issues and all that kind of stuff. If this medication can help people get off drugs, I mean, I'm not claiming that. I don't know anything about that.
Right.
I'm just curious about it. So don't go take that and run with it. I was just curious about it because I have heard that it has helped people as another benefit that have been addicted to different things, not just food, but also alcohol or drugs. And I was like, wow, that's interesting.
And then even autoimmune diseases where people have psoriatic or rheumatoid arthritis and that joint pain, it's helping with that.
Wow.
It's helping postmenopausal women, those symptoms as well. Wow. So not only weight loss, it's like weight loss is a side effect of all the other benefits of anti-inflammation and insulin sensitivity.
I love it. So Doc, let's say somebody just, they kind of yo-yo between that like 10 pounds of weight they want to lose for the summer versus somebody who is obese. Do you have any issue or do you take any issue with somebody who just wants to tighten up for a girl's trip and they want to take semi-glutides, or somebody who is obese and they need to save their lives by taking it? Do you have any feelings or emotions about either one of those populations?
The number one thing that causes a lot of chronic illness is insulin resistance. And so what leads to insulin resistance is obesity and being overweight. Right. So if we're helping decrease that, then we're helping prevent all the other chronic illnesses, high cholesterol, hypertension, you name it.
Exactly.
They're useful in both, but the way that it would be prescribed for each person is a little bit different. So this person who needs to lose the 10 or 15, yes, I would, but I would go lower at a lower dose, and they would have to implement the lifestyle too. To me, it's non-negotiable. You have to exercise and do strength training. You have to eat enough protein and proper foods. And then also during that time period, as you're using it as a tool, you need to go to the psychologist or a therapist and work on the emotional component. Because once we remove the medicine, what about the tools that you have on exercise, on strength training and the food that you eat, and plus your relationship to food, the emotional component on why it feels good to eat these not healthy foods when you're sad or when you're happy.
I love it. So Dr. Jones, how, as a doctor, you see a lot of things. You research, you know a lot of things. How would you want to see the fitness space, my space, embrace folks who are on semi-glutides? How can we do better? How can we do better at welcoming people in instead of helping to create that stigma that you're taking the easy way out, or you don't want to do it the hard way, you're lazy? How can we take that away, take that stigma out and embrace people better in the fitness space that I'm in?
I would say education. I think with the propaganda, people talk about, oh, well, this is diabetes medicine and people who are obese are taking my medicine away. I think that the rarity of the medicine comes when you're talking about the name brand Ozempic, Wegovy, Mounjaro, and Zepbound, that those, the patent or whatever is about the okay, y'all can edit this out. The shortage comes not from the actual medication. It comes from the pens. Okay? So when we're talking about the name brand, they come in these pens that are easy to inject into the belly.
Yeah, self-injectors, right?
Yes.
Okay, got you.
It's a shortage on the self-injectors and the name brand in which insurance pays for. There is no shortage on the actual compounded medication, the substrate.
Because it's ingredients. The ingredients, they're not sort of the
ingredients. That's what I prescribe. And for me in Georgia, the for labs to actually, for pharmacies to actually make this medication, there are really stringent rules. And if they are putting this medication out, they have to follow those rules because they will get shut down. So I do have vetted compounding pharmacies that I do send my patients to get the medication, but I vetted them. Okay. So I don't let a patient come, like with regular medicines, they'll say, I want to go to CVS, I want to go to Walgreens, I want to go to Walmart. For this, I have to vet the compounding pharmacy. I have to know the pharmacist and the owner, be able to call them and to come together, curbside each other to prescribe the medication. And that's continuity of care for the patient. It's safe.
Love it.
But that shortage is with the pens. It's not necessarily with the medication.
Gotcha.
So people who are out here saying that leave this medication for the people with diabetes and not the obese. Well, hello, Mary. Soon the person that is obese will become a diabetic. So who says that you deserve it because you're this far along the process versus someone, and we're in the preventative space.
I like it. And that's a lot of times outrage is because people don't have the information.
Right.
The information is not communicated. So then you get outraged. Oh, these people are just taking away medications for people who are who are diabetic.
Just because your insulin is, your insurance is trash doesn't mean that you get to trash other people. Like, you chose your insurance, and then insurance is... Anyways, insurance doesn't want to pay for stuff.
Well, not only that, Doc, a lot of people, it's just secondhand data. They're like, I heard they were taking away medications for people who are diabetic. I don't like that.
Or the whole gastroparesis thing. Oh, I heard somebody on the medication got gastroparesis, which is paralysis of the gut. You want to know the number one cause of gastroparesis?
What's that?
Diabetes.
Oh, wow.
So the medication has helped putting a lot of diabetes in remission when that's the number one cause of gastroparesis. And yet it is a rare, very rare side effect that someone would get gastroparesis. But the bigger cause of it is diabetes versus the medication.
Okay. I love it. So I take away from that, what I'm doing today is a good start to help people understand, like talk about the education and help them understand what these weight loss meds are, how they're used, where they come from, all those things. And of course, I'll do more podcasts. I'll bring on more doctors, but I wanted to set the groundwork of getting the conversation started. And Dr. Jones, there's no better person than you.
Thank you.
And so the next question I'll ask is, okay, we talked about how I can help with that by giving more education. But how do you personally feel like semi-glutides are going to impact the fitness space, what I do every day?
I think that the ideal candidate and client is someone who's doing E2M.
Got you.
The client that is ideal for these weight loss medications is someone who is exercising, doing strength training, and eating correctly. Meal prepping, intermittent fasting, and needs the medication to jumpstart their metabolism, quiet the food noise, and help them on their journey, while also preventing other chronic conditions. I feel that they work hand in hand. They work hand in hand. So the people who are hating or the victims of the propaganda, you yourself or your family members probably should be on the medication yourself.
Right.
So just because you hating because maybe you don't have access to it, or your physician won't prescribe it, or your insurance is being whack, that's not a reason to vilify the medicine. It's an excellent anti-inflammatory. I feel like it's a miraculous medication. And used properly, which is when your physician gives you proper resources, like says, hey, I'm going to start semaglutide, but you need to do these things. Go to E2M. They'll help you with it.
I like it.
I think that's the way to go.
That's exactly what I want. The way I'm going to address it, my personal way of addressing the change in the healthcare space and the fitness spaces, I'm going to create a new program that's going to be, focused on helping folks, more seated workouts, more low impact stuff, dietary advice based on folks who are on semi-glutides. So I'm going to start working on a new program that will support versus alienate.
Right. Because there is that subset that that their joints hurt so much, whether it be from autoimmune or from being obese, that they need to lose the weight first.
Right.
And you can do things that are low impact in a chair first as they're losing the weight.
100%.
And then as their joint pain is less, as their weight has decreased, then they can hop on and actually join everybody else and everything else. So you are going to be able to capture everyone.
I love it. And I've been approached by lots of companies throughout my time of doing E2M to partner with them on different things. But this is the first time, because I've had so many clients that I've trained over the years, that was the one piece that I couldn't help them with. I can give them an excellent meal plan.
Yeah.
I can give them excellent exercise advice, but I just couldn't quiet that food noise for them. So I was one of those guys that was like, man, weight loss meds, you don't want to do that.
Yeah.
Do it the hard way. But now that I see the benefits for some people, and I'll give you my closing thoughts here about how I personally feel. But
I mean, you can partner with them.
Yeah.
Like they work hand in hand.
Yeah. And
patients on the medication.
Right.
Yeah. It's very, very mutually beneficial to do both.
Right. And I have. So there's a new company that's being formed. A bunch of telehealth folks are getting together and doing a new telehealth company. It's called REM, R-E-M, REM Health. And that's going to hit the market soon. And my reason for partnering with REM Health is that they're going to address the pieces that I take offense to. They're going to actually have health coaches for the people who they're prescribing the medications to, and they're going to talk to them, encourage them to do programs like mine so they can have the full picture and not just the medication. And that's the only reason why I was like, okay, I know that there's people going to be doing the medications whether I want to support it or not.
Yeah.
And instead of me just saying, hey, it's me versus you, how can I embrace you? If you're going to do the medications or you need to do them, I have the other two pieces. So instead of you going to look around for it, if you get medicine from them, come work out with me. And the goal is for a lot of physicians and health spas to understand that the same way my clients go to you to get treated for high cholesterol, high blood pressure, whatever, and you want them to be healthier, you don't just say, hey, go off and also be healthy. You didn't have anything to prescribe to them. And that's why so many folks are recommending E2M to their clients along with the high cholesterol meds or the blood pressure meds. I want the same thing to happen with the weight loss meds. When you give somebody weight loss meds, you also prescribe them a diet and exercise plan as well. What are your thoughts on that, Doc?
That's perfect.
Love it.
Because like I said, if we are seeing patients who mostly try to go through their insurance, we have to see at least 20 patients a day.
Right.
We don't have the time to do what E2M does. So you make our lives easier if we can go ahead and prescribe the medications to help jumpstart, to quiet the food noise. And then we also do the lifestyle prescription of go to E2M.
Right.
We work together. We cover all three legs of the chair.
100%. I love it. Doc, I'll say my closing thoughts and I'll give you a chance to think about your closing thoughts. But my thoughts, guys, on the future of weight loss meds and the fitness space, do what's best for you. That's always my stance. Do what's best for you. But if you are interested in weight loss meds, do your research. Talk to your primary care physician. Talk to somebody who is educated, not just somebody who heard about it or a friend that's doing it. Ask all the questions you want to know. Ask questions about side effects. Talk to somebody that may know your medical history, because you can't get advice from somebody that doesn't know what you're at risk for, what side effects you could be at risk for. So you need to talk to somebody that understands your body, your doctor, your physician assistants, whoever that gives you care. Talk to them and ask them every single question. Every myth you heard, every side effect you heard, ask the question. Before you do anything, be educated first. And if you also get to the point to where you decide to actually go forward with the medications, if you are prescribed them, at that point, understand that you're going to get the medications from one location, but you still need to get diet and exercise from somewhere else. And my staff and I, my robust staff, I'm blessed to have almost 30 plus people on my staff. We'd love to help you. And we're going to focus on making sure that if you're on weight loss meds, that my program is doable for you. That's what I owe you. I'm going to make sure that the program is doable for people who are trying to lose weight gradually, who have joint pain, who need low impact, and who need that dietary advice as well. And not only that, I'm a big person that focuses on the mental strength aspect to help you work on that food noise while it's quieter. While you have it quieted down by the medication, let's work on getting you stronger mentally. I am honored to have so many doctors work with me and support me. I've never seen any other program on the market that's got as many doctors willing to tell their patients about it. So hopefully you get interested, you want to learn more, and I'll give you the ways to learn more here in a second. But I want to pass the mic over to my amazing friend that's been loyal to me for over 20 years. When I was joking before we got started, when I was a scrub, and I was a scrub back in the days.
I don't recall you ever being a scrub,
it's all
sir.
Good. Thank you for your friendship, Doc. And again, thank you for your wealth of knowledge, what you provide to your patients, what you provide to anybody. You are the kind of doctor where no matter where you are, you're looking for ways to help people. You could be sitting at a bus stop and you'll be looking for a way to tell somebody to be healthier. So, Doc, I applaud you. I'm proud of you. And the floor is yours.
Thank you. I appreciate our friendship and just admire what you've done over the last 20 years. Yeah. And we came from the bottom. Now we here.
That's right.
So I am a primary care physician, family medicine. I own the practice, The Healthy Woman. It's in Lawrenceville, Georgia, and it's primary care. I'm partnered with my business partner, Dr. Jocelyn Slaughter-Moore. And I see 12 and older men and women. So if anybody is in Georgia and is interested in a holistic perspective of doing E2M, but you also need semi-glutide or tirzepatide, I'm there to prescribe it for you. So if anybody lives in and around Atlanta, in Georgia, or wants to fly in to see me, because I welcome that as well, we can work together, together with E2M. Right. I can prescribe the medicine, but I also require, it is not negotiable. They have to strength train. Yep. They have to do the nutrition component, and then also use it as a tool and work on the mental health part of why emotionally we are overeating. So us together, partnered, I want my patients to do E2M, and if it's indicated, start the medication. I think that this medication is excellent. It's anti-inflammatory. It's putting chronic disease in remission. It's preventing it. We're also losing weight. And that's a side effect. You can lose anywhere from 13 to 25% of your body weight. And that itself is excellent, because as we come out of adolescence, which is why we always say that we want our children to be set up for success or not. Mm-hmm. When you come out of adolescence, you actually have all the fat cells that you will ever have. Mm-hmm. So it's important for us as adults to help with the next generation, teach them as well. Because when you come out of that, when we are obese, it's not more fat cells. It's the fat cells that we have gotten larger.
Wow.
And so us together, our generation, the next generation, we can make it better. E2M plus your doctors and those that are indicated to prescribe semi-glutide or tirzepatide, it's a partnership. And the E2M part is not negotiable.
I love it. So, hey guys, in closing, do your research. If it's not for you, don't just hate on people that it may be for them. Just stay in your lane because you never know what things people are dealing with, what food noise, what things they're trying to fight every day to just be able to do the best they can. So if you're somebody who doesn't need weight loss meds, that's fine. I'm happy to help you with your diet and exercise. And if you're somebody that decides to go that route or is prescribed that route, I am here to help you too. You can find me and my entire staff, my team, at www.e2mfitness.com. You can find us on the social medias at E2M Fitness. We're always here for you. My goal is to make sure I'm giving you the most advice, the best coaches, the best diet plans, everything when it comes to the health and fitness space. I appreciate your time, and I'll see you soon.